I just always had this sort of deep innate desire to be a surgeon and to help people. The way I ended up in peripheral nerve surgery, I would have to describe as either a complete coincidence or divine intervention. I finished my year as a trauma surgeon, and then I did my peripheral nerve fellowship. And after about 2 or 3 months of just being exposed to it and seeing how it can change people's lives, I knew I was hooked and that's what I wanted to do. But that whole sort of traditional field of peripheral nerve surgery has really been geared towards restoring function. Nobody has ever really focused on the peripheral nervous system with a focus on treating chronic pain. That has been something that has been totally overlooked. The difference between what I do and a pain management setting is that my goal is always to get rid of the pain. Very often in the pain management setting, the goal is to control it to a level where the patient can function. When these patients come in to see you, you can sort of see this burden of pain that they carry, and I refer to it as the pain mask. Very often, once you're able to help these patients, at the end of the process, they look like a different person. I can't help everybody, and not everybody has a peripheral nerve problem. The type of surgery I do is not a silver bullet for every type of chronic pain. But for patients who have a peripheral nerve problem, it's really the only solution that's out there that can really give them excellent relief of their pain. When I'm in surgery, that's my happy place. That's the reason I became a surgeon. That's, I think, the reason most surgeons become surgeons is because you love being in the operating room, you love operating. I mean, there's just a thrill to that all on its own. This is still an untapped field of surgery, meaning, all the problems haven't been solved yet. And so that's another thing that I really like. There's still room to push this field forward, new things to be discovered, new pain problems to be solved. When a patient comes up and says to you, hey, I was suicidal and I was, you were my last shot, and you're able to help them, that's, it's hard to put into words the gratification that you get from that. What can you do where every day you can come home and say, I did my best to help somebody? It's really a pure form of just, you can really look at yourself in the mirror and say, everything I do on a daily basis is geared towards trying to help somebody have a better quality of life.